Ancel Keys' 7 countries study, recognized as one of the most influential investigations in nutritional science, has shaped dietary guidelines for decades. Yet beneath its acclaimed facade lies a complex web of oversights and biases that continue to impact public health today. Initiated in the 1950s, this study sought to link dietary patterns, specifically fat intake, to heart disease across diverse populations. The conclusions drawn from this study contributed significantly to the widespread demonization of fats, steering the dietary habits of millions towards high-carbohydrate, low-fat regimens. However, modern scrutiny reveals a narrative far more intricate and potentially misleading than previously acknowledged. As society grapples with escalating rates of obesity and metabolic diseases, the imperative to reassess the foundational studies that shaped current nutritional guidelines grows. This essay delves into the hidden dangers of the 7 countries study, examining its methodological flaws, the profound impact of its conclusions on public health policies, and advocating for a critical reevaluation in the face of contemporary scientific evidence. Ancel Keys was a prominent figure in nutritional epidemiology, and his 7 countries study was ambitious in its scope, aiming to map the relationship between lifestyle, diet, and the prevalence of coronary heart disease. It spanned 7 nations and recruited over 12,000 men, examining their dietary habits and following their health outcomes over several decades. The results famously underscored a positive correlation between the intake of saturated fats and heart disease, significantly molding public perception of dietary fats. Despite Keys' stature and the initial acclaim of his research, subsequent analyses and replications have pinpointed numerous inconsistencies and selective reporting practices within the study. These issues beckon a thorough reevaluation of its lasting influence. As the world confronts a growing public health crisis linked to diet-related diseases, understanding the real legacy of Keys' work is not just academic, it's a pressing necessity. The study, foundational as it was, suffered from several critical methodological weaknesses. First and foremost, the selection of countries was not random, but rather hand-picked by Keys, which may reflect an inherent bias. Countries like France and Germany, which had high fat consumption but lower rates of heart disease, were conspicuously absent from the study. Further compounding the issue, the dietary data collection methods were rudimentary, often based on brief surveys and small sample meals, not comprehensive dietary records. This lack of robust data collection casts doubt on the validity of the sweeping conclusions drawn. Moreover, Keys' interpretation of the data was criticized for its singular focus on dietary fats, overlooking other potential factors like sugar intake, smoking habits, and lifestyle differences that could influence heart health. Keys' assertion that dietary saturated fat was a leading cause of heart disease led to its demonization and the rise of low-fat dietary recommendations. However, this hypothesis arguably oversimplified human metabolism and the complexities of different fats. Emerging research has started to unravel a more nuanced view, distinguishing between various types of fats and revealing the beneficial aspects of certain dietary fats in heart health. The blanket vilification of all fats based on Keys' conclusions now appears not only unfounded but potentially harmful, as it paved the way for higher carbohydrate and sugar consumption. The initial failure to distinguish between these nuances has had long-lasting repercussions for dietary guidelines and personal health choices worldwide. The influence of the 7 countries study on public health policy cannot be overstated. Its conclusions played a pivotal role in the development of the first dietary guidelines for Americans, which emphasized carbohydrate consumption and recommended limiting total fat intake. This policy shift had profound implications, as food manufacturers responded by producing a plethora of low-fat, high-sugar products. Meanwhile, obesity rates began to climb, correlating with these dietary changes. This period marks a critical juncture where public health policy, influenced by potentially flawed research, may have inadvertently contributed to the current obesity epidemic. As low-fat guidelines permeated through the public consciousness, the ripple effects were seen globally. Dietary recommendations in many countries mirrored those in America, promoting grains and carbohydrates as the staple components of a healthy diet, while casting fats as the dietary villain. This uniform approach overlooked ethnic and individual dietary needs and predispositions, leading to a generalization that may have compromised the effectiveness of dietary guidelines across diverse populations. The adherence to a one-size-fits-all policy, rooted in the American adaptation of Key's conclusions, demonstrates a significant oversight in global nutritional policy planning. The reevaluation of these ripple effects is crucial in understanding and rectifying the global nutritional landscape. In recent years, several high-profile studies and meta-analyses have challenged the core tenets of the seven-country study. These modern critiques often highlight the role of sugars and refined carbohydrates in metabolic disorders, shifting some of the culpability away from fats. Furthermore, the reanalysis of historical data, including that of the seven-country study itself, has suggested that the correlation between saturated fat and heart disease might have been exaggerated or misinterpreted. Such findings underscore the necessity of grounding dietary guidelines in a multifaceted understanding of nutrition science. Given these developments, the scientific community calls for dietary guidelines that are more reflective of current understandings, promoting a balanced intake of nutrients. Today's dietary advice needs to be rooted in the latest scientific findings rather than outdated dogmas. It's crucial that nutritional guidelines are adaptable and based on a comprehensive understanding of the complexity of human diet and metabolism. This requires not only revising what we eat, but also considering how we formulate public health messages. Emphasizing variety, moderation, and the inclusion of beneficial fats could help mitigate the health issues precipitated by the low-fat era. Additionally, acknowledging the individual variability in dietary needs can lead to more personalized and effective nutritional guidance. The ongoing scientific dialogue and its implications for dietary advice are central to overcoming the limitations imposed by previous nutritional studies. The persistence of nutritional myths in public consciousness is largely due to a lack of widespread knowledge about the nuances of diet-health relationships. Public education campaigns are essential to correct misconceptions stemming from oversimplified interpretations of studies like Keys. By enhancing public awareness, individuals can make more informed dietary choices that go beyond dated paradigms. This shift requires a concerted effort from healthcare providers, educators, policymakers, and the media to disseminate research-based information and dispel long-standing myths. Empowering the public with knowledge will play a pivotal role in creating healthier communities and challenging entrenched dietary guidelines. The journey from Ancel Key's seven-country study to contemporary nutritional science has been fraught with controversy and learning opportunities. As we dissect the failings and uncover new evidence, the path forward requires a willingness to question and revise long-held beliefs about diet and health. Reassessing dietary guidelines in the light of modern understandings will not only improve public health outcomes, but also exemplify the dynamic nature of scientific inquiry. Continuing to refine these guidelines with an emphasis on flexibility and accuracy can herald a new era of dietary recommendations that genuinely enhance public health. In conclusion, the legacy of Ancel Keys' study serves as a reminder of the profound impact scientific research can have on public policy and health, at times beneficial, at other times misleading. Thus, cultivating a critical, evidence-based approach in nutritional science is crucial for ensuring that history's lessons lead to tomorrow's solutions.